It's another day with the physicians where your health is our business.
Growth spot the end. So you are not going to take some drastic measures. But a 10-year-old coming, pressure is high. But also to know that it's not only when your pressure is high that you have glaucoma.
Sugar, and I don't know about any other one, but what you know is
You're welcome back to the training also on your regular program. The term heart failure can be frightening. It doesn't mean that the heart has failed or stopped working. It means the heart works less efficiently than normal due to various reasons. Heart failure is a chronic, progressive condition in which the heart muscle is unable to pump enough blood to meet the body's needs for blood and oxygen. Basically, the heart can't keep up with its workload. What are the possible risk factors, the causes, the warning signs, the management, and of course the possible complications of heart failure? These and more are what our guests will be delivering on today's episode of your regular program, The Physicians. Stay tuned. It's another day with The Physicians where your health is our business. Today we'll be talking about heart failure. Anything that has to do with the heart is actually very frightening. What is heart failure? What are the possible complications, the symptoms, the diagnosis, and of course the risk factors? My name is Dr. Martina Agbemi. As usual, I'm not alone on this program. I have with me my regular
I remember Dr. Memuna Yusuf Kadri, and it's always a pleasure to be in your screen. Don't forget, you're the physicians, your health is always our business.
It's always very exciting when you are, I remember that I need to just give those watching very important health tips.
Yeah.
I love the physicians, really. So we're talking about heart failure. Anything that has to do with the heart is frightening. Heart attack, heart failure, heart this, heart that. But then,
we now have two combinations of two things that are frightening.
It has. That is
failing. So you can imagine how that sounds when someone says, I think I'm having a heart attack.
Yeah, okay.
So I'm happy that we have an expert that will help us look into, because sometimes you find that the cardiologist will say, no, you need to see a psychiatrist.
In fact, I'm actually very excited because the guest we have today is firebrand. We don't have enough time, so let's just ensure we just bring him in ASAP.
Because we need this. Words of wisdom is experience, and it's always a good guest when it comes in here.
Yeah,
we learn a lot.
So just take your paper and the biro and listen. Don't go away. We'll be back after the short break. Stay tuned.
That irregularity can come from the upper chamber or it can come from the lower chamber. For example, a condition called atrial fibrillation, where this upper chamber is just quivering, is going to affect the function of the heart.
Welcome back. If you are just joining us, you're on to your regular TV health talk show, The Physicians, where your health is our business. Today we're talking about heart failure, the risk factors, the symptoms, diagnosis, possible complication, and of course management. With me in the studio we have a consultant cardiologist, the MD, CEO of United Heart Hospitals here in Lagos. You're welcome, Dr. EUGENE NWOSU. You're welcome to our program, The Physicians.
Thank you for having me.
You're welcome. It's always a pleasure having you here on the show.
Thank you.
With an individual who has a heart failure, how do you recognize it? What are the symptoms? How do you recognize that this person has a heart failure?
Okay.
The presentation.
There are different symptoms, but what I want to warn you is that one symptom of that doesn't mean heart failure. If you have 2 or more of these symptoms, think about that and try to see a doctor. Okay. So let us start with the heart. When you have heart failure, generally speaking, because each contraction does not produce enough blood in the circulation, your heart tries to compensate by beating a little faster. So heart failure can present with palpitation. You recognize that your heart is beating fast. Or you try to do something very minor, your heart is beating fast. That's pay attention to that. The other one is you get tired very easily. You don't have the energy you used to have. So you want to do something, you're just out. So that tells you that your heart is not meeting the demand for that. So tiredness and fatigue and weakness. The other one is difficulty breathing. So the reason for that is that when you have heart failure, especially left-sided heart failure, blood backs up in your lungs. You start filling your lungs with fluid, and that will make you breathless, especially when you try to lie down at night. You find out if you lie flat, you can't breathe. You have to now raise your head up, you breathe. Some people with heart failure feel that they can't even lie down. They have to sit on chair or sleep on recliner. Pay attention to that. Okay, so that is that. The other thing is because you have fluid backing in your lungs, you start coughing and wheezing. Some wheezing is not asthma. It's what we call cardiac asthma. That means there's a lot of fluid in the lungs, then you start wheezing. I've seen people that are having heart failure and they're treating them as if it's asthma.
Wow. So now we know all those risk factors.
So no, we're still coming. There's still a lot of symptoms. We are going stage by stage. Now, what about congestion in the GI, the intestine?
Okay.
When you have heart failure, the body is very smart. The stomach and digestion is not that important, so it will decrease the blood supply to the stomach so that it can send more blood to the brain and the more important organ. So you might lose your appetite. You don't feel like eating. And also because of the congestion that happens in most of the organs, your stomach and this intestine becomes congested, and sometimes you start having pain. I have admitted people transferred to me with severe heart failure, and they're treating them with ulcer medication because they're having a lot of stomach symptoms. Okay, so and also at that time you are not absorbing your medication, so even if they are giving you heart failure medication, it doesn't work. That's why you need to give it IV, because the stomach is congested. The other one also is that you start having swelling all over the body. Your legs are swollen, and you start, sometimes bad cases, your abdomen is full of fluid, what we call ascites. And then also, because you are not getting enough blood to the brain, you don't think properly, your memory, you're a little bit confused. In fact, your loved ones that know you very well will say there's something wrong.
But they don't know what it is.
They don't know. And of course, general fatigue. So any of these symptoms are from heart failure, but make sure, because you have one of that, it doesn't say, if you have a combination of that, you go to a doctor that can make the diagnosis.
Who is a cardiologist, by the way, which is
cardiologists are the best people to handle heart failure. Actually, okay, so.
But any gender differences?
No. Listen, there is no discrimination here. Just like heart attack, we've talked about women and heart disease and heart disease in women.
So
There is no discrimination.
no men more than women.
No, there's no discrimination.
Uh-huh.
Heart failure
It's heart failure.
common in men, common in women.
Any
The same thing.
age?
Actually,
The older?
some of these risk factors are common as you get older. Okay, diabetes, high blood pressure, those things are common. If you have sickle cell disease, you know, if you're severely anemic, even in your teens or stuff, you're gonna have heart failure because you don't have enough blood.
Yeah.
Okay, so those are the differences. Okay.
So you've talked about the symptoms and the signs. How do you recognize that the person's heart failure is worsening?
Well, basically, first of all, you have to make diagnosis. Okay? So you have to make diagnosis, and then, of course, when you make diagnosis, if you don't receive proper treatment, your condition will get worse. So I think at this point, we should just mention very quickly how diagnosis is made.
Okay.
Okay. The most important thing in diagnosis is that when you recognize that something is wrong, go to the right doctor to make the diagnosis for you. And to make the diagnosis starts by listening to your history. Ask you the proper questions, do a physical exam, and the physical exam, a good doctor will detect all this. Then you need tests for confirmation. And some of the tests is also good to guide you on medications and to make sure that certain key medications you can tolerate. For example, if you are coming to have heart failure when you already have kidney failure, that's a serious issue because some of the key medications for heart failure you cannot take because of kidney.
Yeah.
So first of all, you do a simple blood test. Okay, simple blood test, we check your electrolytes, you know, sodium, potassium, and kidney function and all that, very important. And then you do a full blood count. Supposing you come to heart failure and you have all this and your hemoglobin is 6, you need blood transfusion.
Immediately.
So people think, full blood count is not important. It is important. You have to do that. Okay, so you do some of those basic blood tests, you do urinalysis, and you do a chest x-ray, because the chest x-ray will also give you information about how serious the congestion is in the lungs and how big your heart is. You do an ECG. ECG can tell you whether you have irregular heartbeat.
What's ECG?
Electrocardiogram is a simple test to check the electrical activity of the heart by putting the electrodes, and then you're going to have a printout on a paper.
How the heart is functioning.
Yes, you're gonna show the electrical activity. You can use it to make a lot of diagnosis. You can even tell you if there was, previous heart attack or if the heart is enlarged. But the key test is trying to find the ejection fraction to define it, and it is echocardiography.
So is that like a gold standard?
It is the gold standard. Okay. There are other modalities that can give ejection fraction. We don't have most of them in this country, like nuclear scan, okay? Nuclear scan to give you cardiac catheterization. We have a few centers here that can do that to tell you how strong you can measure. But the simplest and easiest one that is available in most parts of the world is echocardiography. So when you do that, you have all the basic tests you now need. And remember when we started this, by the time you do echocardiogram, you now know the ejection fraction. Because that's going to direct you on how to treat.
That might be a bit difficult because it's a personal thing, except the person speaks out or when there is that sudden cardiac arrest.
It is not really noticeable, except if peradventure the heartbeat, the way the person is respirating. Some people, you see the way they are breathing. From there, you can know that this person has a heart problem.
It's high cholesterol food, it's butter, that's oil.
When we have spicy foods.
Eating fatty foods, oily foods and stuff like that.
We really need to watch our lifestyle.
Regular exercise, regular exercise.
Heart failure can be prevented by eating right and living right.
They are interrelated, so to say, because if you are depressed, if someone is depressed, the fact that the person is thinking too much adds some, psychological upset. It can also trigger heart failure or cardiac arrest. So it is an interwoven thing.
No, it cannot. It cannot, because it's a normal, to them it will be a normal thing. Once the heart failure is away, they live their normal life. It's just a normal health condition that can always be managed.
Okay, so Dr. Woods, I'm not taking you back. Because you've made mention of hypertension,
Yes.
okay, being a risk factor for heart failure. For patients or individuals that probably have the history of hypertension because they say it's genetic from the family, a family history, and they know that their parents actually, when they were hypertensive, they used a particular medication without seeking medical counsel or the expert advice, they decided to use those same medication. How do you think those people will cope? Because I believe not everyone should use the same medication for treating high blood pressure. So how do you think
That should be completely discouraged. It is the wrong thing to do. First of all, you are doing self-medication.
Yeah.
Because your parents took it doesn't mean that genetically you are totally the same.
So just maybe before
It's not a
anybody takes any
one-size-fits-all.
medication for
Yeah.
like high blood pressure, you must know.
Yeah, definitely. This should be discouraged. People, not just high blood pressure, people who have this, they go to pharmacy
Even
and
malaria.
buy
As common
antibiotics
malaria
and,
as it is,
it's terrible. It's a problem, okay? That should not be encouraged. That is a no-no. I don't even think we should talk about it. In other words, it should not be done at all. It's only in places like Nigeria you have such problems, because in most of the world you can't buy those medications without a prescription from. So, but you are harming yourself. You are not doing yourself any good.
I brought this point because I want people to really understand that before they use medication for this high blood pressure,
Anything,
they should
any
at least seek
medication,
medical
not just high blood
counsel.
pressure.
Seek medical counsel.
People, we are having antibiotics resistance here because it's so
lot.
abused. Somebody
lot
just
happening.
have a little, sniffing cold. They have used this antibiotics.
You know the most frightening thing?
It's
These days you have people, they move around, they walk around marketplaces to check blood pressure. And they tell you your blood pressure is high, you can just go to the pharmacy. The pharmacy will just give you medication.
That should
A
be
whole
highly
lot of
discouraged.
abuse.
It should be a no-no. Okay,
It's
it should
killing
be
more people than
anybody that is doing is totally ignorant, and you should be smarter than that.
Yeah.
Okay, so if you are doing it, and after this program you are now still doing it, I don't know.
Ignorance is not an excuse.
Oh, it's not an excuse. Okay.
So I just want to ask her before we leave, what are the treatment options and the possible complications?
All right, good question. So first of all, treatment starts with making the proper diagnosis, and then lifestyle. There's, so you first of all you have heart failure, and for this, let's just stick with heart failure with decreased ejection fraction, because you can't cover all the different heart failures. So let's start with that. So heart failure with decreased ejection fraction, you make the diagnosis, and then there are some lifestyle changes. If you're having heart failure, just like if you have hypertension, even if you don't have hypertension and have heart failure, decrease their salt intake. Salt is not good for the circulation and for the heart. Decrease their salt intake. Now, if you have heart failure and you're already congested, yes, part of the treatment will to give you diuretics to decrease that, but you need to cut back on your fluid intake. And listen, people with heart failure love water. They can drink. When I was practicing in America, there are some heart failure patients, they are so thirsty that in their rooms, we have to turn off the tap, because if not, they will go there and drink. Okay, the thirst is increased with heart failure. So fluid restriction is important. Okay, now once you start on treatment, low-level exercise is good. Even though you are in heart failure, you're encouraged to do some exercise. In fact, in developed countries where they have cardiac rehab, cardiac rehab is part of the treatment for heart failure. Okay, and then wise eating, vegetables and fruits and all that stuff. Eliminate things like alcohol. Okay, if you are drinking because alcohol weakens the heart muscle, you have to cut back and eliminate that. If you are smoking, all those health issues. So those things are actually where the treatment starts. Then you now start addressing the other stuff. For example, some people with heart failure coming to see with a blood pressure of 180/110. You gotta control the blood pressure.
Sure.
You have to choose the right medications to control the blood pressure. Some people with heart failure, their heart rate is fast, and controlling the heart rate is also important. Let me just throw this out. If you had heart failure and you go to your doctor and your heart rate is 90, even if you are feeling well, that's not good. The target heart rate for you should be about 70. So I see a lot of people that are undertreated. Okay, they are feeling okay, but heart rate is 90 and stuff like that. So you have to control the heart rate. There are medications to do that. Now, because they are swollen and they have, edema and swelling, you have to give them diuretics to clear that. That will make them feel better. Okay. Now, having said that, there are some key, with advances in pharmacology, there are some key medications that has made tremendous difference in the treatment of heart failure. Before, when I was in medical school years ago, the good old days at UCH in Ibadan, okay, so you find out that the diagnosis of heart failure was as terrible as telling you that you have liver cancer, because 50% of them are dead in 1 year. But these wonderful medications that have come on board, using them in the proper combination, have basically restored people with heart failure, prolonged their life.
Wow.
Some of them are living, a high percentage are living 5 years. And as a matter of fact, with good combination of medication, you can actually restore their ejection fraction that was low back to normal. Okay, but it needs proper adjustment. And I tell you this, treating heart failure is not one drug. It's multiple drugs. We call it a cocktail. Okay, so when you do your cocktail, you put a little bit of, add it. So that's what heart failure treatment is, a cocktail. So all this, if you get it right, you will actually improve their symptoms. They get their life back, and they're almost like normal people. And also, I want you to know that heart failure with decreased ejection fraction is very deadly, especially when your ejection fraction is 35% and below. Cardiac arrest without one is very, very common. And that is why such people will need an advanced procedure called an ICD, a defibrillator, to prevent them from having sudden death. But it's the medication, it's the combination of medication that will heal them and improve their functional status and make their heart stronger.
Yeah, well, time is never enough. My name is Dr. Martina Agberia. Ensure you always keep in date with the physicians.
Thank you very much. It has been a blessing. Why am I saying it's a blessing? It's for the fact that when you hear the word heart failure, it's more like a death sentence, but it's in your hands, viewers. Till next time, I remain Dr. Memuna Yusuf Kadri, and please don't forget to follow us on all our various social media platforms. If you want to be here, you're just a click away. Just let us know, and you'll be invited to be our guest in the studio. God bless you.
My name is Oluwakemi Famuyua, a consultant hematologist at General Hospital Bagada, and today I'm on Physicians talking about sickle cell disease, its causes and complications. Thank you.
All these black spots in my field of view, which is the reason why all diabetics, if that is the only thing that one is going to take away from here, as a diabetic, you must have your eyes examined by your ophthalmologist or optometrist, as the case may be, who is trained in that, you know.